Increased weight oftentimes has a multiple fold effect on the hip and knee. Oftentimes, activities such as getting up from a seated position or climbing stairs, you can see a 5-fold increase in weight experienced on the hip and knee during those activities. So elevated body mass index or elevated weight can really impose significant increase in stress on the hip and knee and result in early arthritis. There are multiple issues that are caused by increased body mass index or weight. The biggest one is infection. So infection after a hip or knee replacement is really catastrophic. I happen to specialize in a lot of infections from the community, so it's something that I just cringe seeing in my practice. Generally speaking, when a patient comes to me with an elevated body mass index and I'm concerned about their safety, if their BMI is between 40, 45, or 40 to 50, I, at the very least, will start a medical weight loss program. If they have uncontrolled diabetes or their BMI starts to get over 45 or 50, that's when I'm oftentimes offering them both the medical weight loss option or bariatric surgical option, and at least giving them an educated view of that option, because it is quite effective and safe.